Welcome to this explainer. Okay, today we are diving into a really wild, rapidly evolving frontier where extreme human endurance crashes right into medical science. The big question we're tackling, with outdoor events getting more and more extreme, could wilderness event medicine actually become an entirely new official medical specialty? I mean, think about it. If you've ever been to a massive outdoor festival, maybe a trail race or a multi-day backcountry event, picture this. A medical emergency happens. But instead of being in a city where an ambulance is literally 5 minutes away, you are miles from the nearest paved road. You're deep in the wilderness, and you're not just with a couple of hikers. You're surrounded by thousands of athletes or festival goers. What on earth happens then? Well, extreme environments completely rewrite the rules of medical care, and that is exactly the puzzle we're unraveling today. Section 1. The origins of crowd care. Okay, let's dive into this. To wrap our heads around how we care for massive crowds in the wild, we kind of have to look back at how we learned to care for massive crowds anywhere. The roots of mass gathering medicine actually trace straight back to battlefield survival. Over a century before modern emergency medical services existed, a French military surgeon named Baron Dominique Jean Laure came up with the flying ambulance during the Napoleonic Wars. These were horse-drawn carts that rapidly evacuated wounded soldiers. Fast forward a bit to the 1950s, and the US military started using helicopter evacuations from MASH units during the Korean conflict. But get this, it wasn't until a landmark 1966 report pointed out that you'd actually get better medical care in a combat zone than on a US highway that civilian care finally started catching up. This led to the very first standardized EMT curriculum in 1971. Eventually, event organizers had a light bulb moment. They realized they could adapt those exact same combat triage and field care strategies for civilian events, mostly to keep local hospital resources from getting completely overwhelmed. So the crucial point here is something called the patient presentation rate, or PPR. This is simply the number of patients who present for medical care per 1,000 attendees at any given event. Definitely keep this metric in the back of your mind. It's the absolute gold standard that organizers use to measure the demand for medical care. And it's the exact data point we're going to use to measure the sheer chaos later on in this explainer. Section 2. Managing Event Medical Logistics. Planning for the Masses. Before we trek out into the wilderness, let's take a look at the intense planning required to keep thousands of people safe at standard bounded mass gatherings. Like a massive stadium concert or a big city marathon. And this brilliantly illustrates what that looks like on paper. The ICS Form 206 dictates the highly bureaucratic reality of saving lives. The whole goal of event medical care is to reduce the burden on the local community's healthcare system. So to do that, the event medical director meticulously fills out paperwork just like this to map out medical aid stations, coordinate life support transport, and establish radio communication frequencies long before the very first attendee even arrives. Planners aren't just looking at the raw size of the crowd either. They literally have to predict human behavior. Will the crowd be mostly older folks who might be prone to heat-related illnesses? Or will there be mosh pits and, let's say, uninhibited behaviors fueled by alcohol and drugs at a rock concert? Are the attendees seated safely in an arena, or are they constantly moving around? Every single one of these factors dictates exactly how many medics, physicians, and supplies need to be stationed around the venue. Which brings us to a massive distinction in the event medicine world: bounded versus unbounded events. A bounded event is your typical stadium game. It's contained, it's controlled. If someone gets hurt, you know exactly where they are, and an ambulance can easily just pull right up to the concourse. But an unbounded event? That is when things get highly mobile, super remote, and vastly more unpredictable. People are far more likely to get injured, and simply tracking them down becomes an absolute monumental challenge. Section 3. The Wilderness Event Challenge. Extreme Environments. Now, we are leaving the stadiums and city streets completely behind and entering the unbounded wilderness. This is where standard medical models totally break down. We're talking about multi-day adventure races or brutal backcountry endurance challenges. These events combine extreme athletic performance, sometimes going on for days at a time, with a total, complete lack of standard infrastructure. Think about it. In a city marathon, a rolled ankle means a quick golf cart ride to a nice, covered medical tent. Out in the wilderness, that exact same rolled ankle can suddenly turn into a massive multi-hour logistical extraction nightmare that requires specialized equipment and full-blown search and rescue teams. And the medical threats out here, they are wildly unique. For example, medics at the Burning Man Festival out in the Black Rock Desert have to treat something they call play afoot, which is basically a chemical burn caused by the low pH of the desert sand. Jungle races pose huge risks for rare infectious diseases. Then you have severe exposure to extreme heat and freezing cold. Oh,
and the terrifying reality that critical patients might actually have to be stabilized for hours or even days before they can be safely extracted. Because this care goes so far beyond basic first aid, these events frequently require actual board-certified physicians right there in the dirt. The statistics on this can be absolutely staggering. Take the Eco Challenge Adventure Race in Borneo. After the event, researchers followed up with 158 of the participants. An unbelievable 44% of them were diagnosed with leptospirosis. That's a really severe bacterial infection. This perfectly highlights a danger totally unique to wilderness events: delayed diagnosis threats. The event planners might think the race went smoothly on the day, completely unaware that a massive health crisis is secretly brewing in the days that follow. Section 4. Defining Wilderness Event Medicine, a new medical approach.
So how do we actually quantify this danger? Well, let's bring back that patient presentation rate we talked about earlier. Let's compare standard crowd injuries with the extreme realities of the wild. At the 1984 Summer Olympics, which was a largely seated event, only 1.6 people out of every 1,000 needed medical care. Not too bad. At a highly mobile rock festival, it jumps up to 17. A standard marathon pushes it to 28. A grueling 2-day bicycle event, now we're up to 80 patients per 1,000. You can see the clear trend here, right? As the event becomes more mobile and more physically demanding, the injury rate just steadily climbs. But what happens when we move those massive crowds out into the wilderness? A review of multiple wilderness mass gathering events found that the patient presentation rate absolutely rockets to between 100 and 400 per 1,000 attendees. Yeah, you heard that right. That means up to 40% of the people at a wilderness event are going to require some form of medical care. It's wild. This staggering spike in trauma and illness completely shatters standard medical planning, and frankly, it absolutely justifies a totally new medical approach. Section 5. A new medical specialty, Wilderness Event Medicine. Because the risks and the logistical hurdles are just so extreme, researchers and physicians are actually pushing to categorize Wilderness Event Medicine, or WEM for short, as a completely distinct subspecialty of mass gathering medicine. Researchers like Dr. Burdick and Dr. Brosen are proposing a brand new Class 4 mass gathering classification specifically for wilderness events. Now, normally an event needs about 1,000 people to be considered a mass gathering, but they argue for lowering this threshold to just 200 participants for wilderness events. Why? Because the extreme environmental risk and the fact that an injured person is likely more than an hour away from definitive hospital care means that even a much smaller group requires massive, highly specialized medical preparation. But right now, this emerging specialty has a pretty major problem: a total lack of data. Without standardized guidelines on what even constitutes a reportable injury, event organizers are effectively flying blind out there. If one race only reports major trauma like broken bones, and another reports literally every single Band-Aid they hand out for a blister, it is impossible to know what medical supplies are actually needed to pack for these extreme endurance races. Let's move to and see how this builds a safer future for everyone involved. The proposed solution is a centralized internet database where organizers can upload standardized data after every single event. We need to track exactly who was there, how harsh the terrain and weather were, exactly what kinds of injuries occurred, and what level of medical professionals were actually on hand to treat them. By feeding all of this data into a unified model, we could accurately predict required supplies and ultimately prevent future backcountry catastrophes. Which leaves us with this final thought. When thousands of people decide to push the very limits of human endurance in some of the most unforgiving environments on Earth, medical teams have to be ready for absolutely anything. But to be ready for anything, we first have to learn from everything. So is data the ultimate survival tool in the wild? Thank you so much for joining me on this explainer. I hope this gives you a whole new appreciation for the incredible, behind-the-scenes logistics keeping us safe when we venture way off the beaten path.